Hello and welcome in today's classroom. Today we shall be talking about the role of IT in environment and human health. Firstly, we shall talk about the objectives. Environment and human health, health information technology, remote sensing and GIS information technology in hospitals, public health informatics in enhancing public health surveillance. Information technology has a significant hand in improving the status in the field of environmental education and human health as compared to that of the other respective areas such as business, economics, and culture or politics. The emerging growth of the internet services and facilities, geographic information system or GIS, and the data that gets transmitted through satellites, etc., have generated a higher prosperity of the updated information on several aspects of the environment as well as health. Various softwares have been developed for environment and healthcare which are user-friendly and help in better understanding of the phenomenon. Health depends on the environment in which one is born and brought up. Environment can be both a cause as well as a cure of many diseases. Regarding health and disease, environment may be divided into two headings: external and internal environment. Earth's surface and the environment surrounding are important to human health. The nature of soil, water, air, temperature, wind, cloud, rainfall, humidity, etc. determines man's health and welfare. Pollution of the environment results from a wide range of human activities: uncontrolled disposal of human excreta and refuse, industrial discharge, smoke from coal and oil burning, fumes from motor vehicles, misuse or overuse of insecticides and fertilizers. Population explosion results in malnutrition, overconsumption of food that causes obesity, diabetes, and dental decay and poverty. Congestion of cities primarily leads to air and water pollution that are starting points for many diseases. Information technology is one of the fastest growing recent technologies. A lot of techniques are used under IT for development and application of computational tools to acquire, store, analyze, and visualize satellite data that is used for observation and protection of environment. Information and communications technology has been referred to as a key instrument in healthcare delivery and public health internationally. When designed and implemented effectively, ICT can improve access for geographically isolated communities, provide support for healthcare workers. IT in human healthcare involves the use of digitized products, online database, and network infrastructures as the means of communication between hospitals, physicians, and patients. IT will play a critical role in decisions regarding the future of personal health management and healthcare reform. In the environment, information technology applies to quality monitoring and management, pollution source supervision and management, environmental statistics, environmental assessment, ecosystem management, nuclear safety and management, environmental information release, and so forth. Auto monitoring is widely used in environment quality monitoring and pollution source monitoring. It uses many information technologies such as online data collection equipment, data delivering technologies, and data processing technology. Environment and human health. The natural environment contributes significantly to people's health through the quality of air we breathe, the food we eat, and the water we drink. On the one hand, it offers health-enhancing economics and recreational opportunities. On the other, it is threatened by activities such as transport, industrial processes, and waste management practices. The World Health Organization defines environmental health as those aspects of the human health and disease that are determined by factors in the environment. Environmental health includes both the direct pathological effects of chemicals, radiation, and some biological agents, and the effect on health and well-being of the broad physical, psychological, social, and natural environment, which includes housing, urban development, land use, and transport. Natural environments provide numerous challenges to human health and well-being, and many of these challenges are continuing to grow and develop, both in ways that we can reasonably forecast and ways that we cannot. Human health information technology has tremendous application in the field of environmental education and health, as in any other field like education. Development of internet geographical information system has generated a wealth of information and various aspects of environment and health. Environmental threats to human health. People experience the environment in which they live as a combination of physical, chemical, biological, social, cultural, and economic conditions that differ according to the local geography, infrastructure, season, time of day, etc., etc. The different environmental health threats can be divided into traditional hazards, which are associated with lack of development, and the modern hazards, which are associated with unsustainable development. The changing pattern of environmental health hazards from traditional to modern with time has been called the risk transition. This transition in risks occurs before the epidemiological transition, shift in the relative importance of traditional and modern diseases that accompanies development. Modern hazards are related to rapid development that lacks health and environment safeguards and to unsustainable consumption of natural resources. These hazards include water pollution, air pollution, chemical and radiation hazards, infectious disease hazards, deforestation, and other major ecological change at local and regional level. Health, environment, and sustainable development. In 1992, the world's leaders adopted the principle of the Rio Declaration and Agenda 21. Agenda 21 is a non-binding action plan with regard to sustainable development. Rio Declaration stated, human beings are at the center of concerns for sustainable development. They are entitled to a healthy and productive life in harmony with nature. Many countries have formulated national plans for sustainable development that give increased weight to health and environment concerns. Health is now a concern for almost every sector of society, not just the health sector. Thus, it is understood that appropriate developments must occur in agriculture, industry, and energy if sustainable health improvements are to be attained. That said, the healthcare has an important role as advocate and guide for health development. Information technology in health sector, by providing new ways for providers and their patients to readily access health information, IT has the potential to improve the quality, safety, and efficiency of healthcare. However, relatively few healthcare providers have fully adopted IT. Low diffusion is partly due to the complexity of IT investment, which goes beyond acquiring technology to changing work processes and cultures and ensuring the physicians, nurses, and other staff use it. Role of IT in environment and human health. Technology has played a key role in the development of human society. Development of sophisticated instruments like computers, satellites, etc. has resulted in total revolution in all spheres of life. Health information technology. In general, IT allows healthcare providers to collect, store, retrieve, and transfer information. However, more specific discussion of IT in healthcare is challenging due to the lack of volume of applications and a rapid pace of change in technology. IT can be used simply as a passive tool to store patients' information or can include multiple decision support functions like individualized patient reminders. IT in human healthcare provides an interactive network where medical facilities, physicians, and providers can communicate, collaborate, and ultimately increase the quality of healthcare worldwide. Remote sensing and GIS. Remote sensing and GIS is effective tool in environment management. Now, environmental changes can be accessed through satellites by remote sensing. The occurrence of natural calamities like droughts, floods can be predicted well in advance. Such assessments help the environmentalists and planners to take ameliorative measures to minimize the effects of these extreme natural events. The Ministry of Environment and Forests, Government of India, has created an information system called Environmental Information System or ENVIS, providing a network database in environmental issues like pollution control, renewable energy, desertification, biodiversity, etc. A geographic information system is a system designed to capture, store, manipulate, analyze, manage, and present all types of geographical data. Modern GIS technologies use digital information for which various digitized data creation methods are used. The most common method of data creation is digitization, where a hard copy map or survey plan is transferred into a digital medium through the use of a CAD program and georeferencing capabilities. Application areas of GIS. GIS are now used extensively in government business and research for a wide range of applications including environmental resource analysis, land use planning, locational analysis, tax appraisals, real estate analysis, and archaeological analysis. One of the first major areas of application was in natural resource management, including management of wildlife habitat, floodplains, aquifers, recreation resources, wetlands, agricultural lands, forests. Environmental health agencies at all levels of government and the partners that support them, universities, non-profit organizations, IT vendors, and consultants are increasingly using geographic information system technology to assess and protect the health of the populations they serve, understand the impacts of the environment on human health, and improve environmental health service delivery. WHO says GIS is suitable for analyzing epidemiological data that would be more difficult to discover in tabular format. It allows policymakers to visualize problems in relation to health service and provides the natural environmentalists an idea platform for the convergence of disease-specific information. Information technology in hospitals. Relatively little is known about the level of diffusion of IT in hospitals and strategies hospitals take when making IT investment decisions. The existing information about IT diffusion comes from voluntary surveys. Given the evolving state of the technology, varying estimate of IT diffusion exists. Information technology in physicians' practices. Like hospitals, physicians are more likely to use IT for administrative functions such as billing, claims submission, and scheduling, than for clinical functions such as electronic health records, clinical decision support, access to formularies of other references. 77% of physicians access the internet, 53% obtained information on treatment, 32% obtained information on formularies, and 11% used IT to write prescriptions. Public health informatics is defined as the systematic application of information and computer science and technology to public health practice, research, and learning. It is an interdisciplinary profession that applies mathematics, engineering, information science, and related social sciences to important public health problems and processes. Public health informatics is a subdomain of the larger field known as biomedical or health informatics. Numerous opportunities are available to facilitate public health informatics impact on public health surveillance. An important opportunity is the increasing adoption of EHRs and health information exchange systems. Electronic health records. Electronic health records and health information exchange systems collect information about individual patients from different information systems, for example, registration, clinical record, laboratory, and through information exchange from across different provider entities. Technological advances. Electronic real-time data regarding the environment, for example, water quality data from supervisory control and remote sensing systems, continuous collection and transmission combined with the GPS and GIS revolutions also facilitate the overlay of environmental information. Mobile applications, the new tech face of healthcare. Mobiles and handheld devices and the wide-ranging applications that it offers for the healthcare professionals exemplify the latest dimensions that the use of information technology in healthcare is taking. Today, for a healthcare professional, be it a doctor or a laboratory technician, there are wide varieties of specific functions-based applications that are enjoying increasing popularity as for their typical on-the-go. Precise and error-free maneuverability that can be accessed by a healthcare professional just with the fingertips. The most important aspect of the use of mobile applications in healthcare is improved access to healthcare by the patients, better qualitative improvement through real-time information sharing, and better engagement of both healthcare professionals and patients. Current status of health information technology. The degree of IT use varies by healthcare settings. Pharmacies are generally advanced users, while physician officers or nursing homes are further behind. The kind of technology used also varies by setting. For example, in home healthcare, the use of technology that allows patients to monitor their own vital signs from their home and communicate results to the agency could increase the ability to address a problem before a patient requires acute care. IT also has a significant impact on consumers. Numerous websites have made health information more available to patients, thereby strengthening their role in care decisions. It also helps consumers choose providers by allowing insurers, including Medicare, to post information on providers, including comparative quality information. Delivering quality health care requires providers and patients to integrate complex information from many different sources, thus increasing the ability of physicians, nurses, clinical technicians, and others to readily access the right information about their patients should improve care. The ability for patients to obtain information to better manage their condition and to communicate with the health system could also improve the efficiency and quality of care. This potential to improve care makes broader diffusion of IT desirableness. Environmental Information System and Health Sciences. The Ministry of Environment and Forests has created an information system called Environment Information System. With its headquarters in Delhi, it functions in 25 different centers all over the country. The ENVIS centers working for generating a network of database in areas like pollution control, clean technologies, remote sensing, coastal ecology, biodiversity, Western Ghats, media related to environment, renewable energy, desertification, mangroves, wildlife, Himalayan ecology, mining, etc. The National Institute of Occupational Health provides computerized information on occupational health, that is, the health aspects of people working in various hazardous and non-hazardous industries. Safety measures, satellite imageries provide us actual information about various physical and biological resources and also to some extent about their state of degradation in a digital form through remote sensing. We are able to gather digital information on environmental aspects like waterlogging, desertification, deforestation, urban sprawl, river and canal network, mineral and energy reserves, and so on. Information technology in human healthcare involves the widespread use of digitized products, online databases, and network infrastructures as the means of communication between hospitals, physicians, providers, insurers, patients, and suppliers. Always evolving and advancing, health IT will play a critical role in decisions regarding the future of personal health management and healthcare reform. While coming to the conclusion, let us be frank to share that information technology is rapidly growing in every sector of development, especially in the environment and human health space, with increasing applications and providing new avenues with an effective role in education, management, and planning in these fields. With this, today's topic comes to its conclusion. See you in some another classroom with a different topic. Till then, goodbye and good luck.